forward in the background. We have liftoff. Very excited when technology works for me. Fantastic. All right, so just an overview on the reason why we're all here today. I'm sure there might be other reasons, but the FASD Respect Act, as we're calling it 2.0, the bill is pretty much finalized now with wording. We changed some ands, ifs, or buts in the language to be a little bit broader as it relates to supports and services for people with FASD. Places where they said that they had to have and, we changed to or to broaden the scope of any funding that might be coming to states or tribal entities being able to provide support, not just prevention services, to people with FASD. So that is all kind of wrapped up and done. There is a draft of that on the website. If you want to take a look at it, it hasn't really changed that much from last month. And we may have a new update again here very soon. But in essence, it goes through a standard case definition and, what is FASD? And that's important because without that, some states are going with older federal definitions that don't include the full spectrum of FASD. So kind of an important consideration. I noticed in the chat that Carl had asked a question about the debt ceiling limit bill affecting this legislation, and we will get to that absolutely. This is a bill that will provide funding to states and provide authorization for the federal government to run programs that will provide support services, awareness, all of those activities that we work on as advocates and people supporting individuals with FASD. It also supports reinstating the Centers for Excellence and refunding that program so that there can be best practices shared across the country. And we're not reinventing the wheel constantly. There'll be a central sources for technical support to give organizations and states the support they need in order to be able to use best practices in supporting people with FASD. So, current bill status. It is entirely possible that the bill will drop while we are on this Zoom. We understand from our Senate sponsors that, our Senate authors, that the bill will be introduced this week in the Senate and next week in the House. The House cannot introduce this week because while they may be in session, it is pro forma and they do not do any work outside of what they're there to do, debt ceiling. So it has to be introduced during regularly scheduled session, which is next week for them. So
they might, I mean, they're going to be in session tonight on the debt ceiling bill, but I don't know that it's going to be. I doubt if they would allow any introductions, but I know, we know that. So
yeah. Well, and we had heard from Bacon's office that they can't during a pro forma session anyway. They can only.
I mean, this will be a regular session. It's just I don't know whether they're, it's going to, because they're voting on the debt ceiling tonight. But yeah, we'll. I think we're safe to say next week in the House, maybe the Senate this week.
Yeah,
and all the publicity will be next week.
Right.
Yeah.
Yeah. The Senate has said that they will wait until the House introduces to do the full press releases and any information coming out publicly about the bill. Question in the chat about states that are working on state bills. How will that work with this? Should we hold off working on state legislation? And my quick answer to that is no, don't wait, because it can take multiple sessions for legislation to pass. And so just like Carl says in the chat, keep moving. You know, we can always amend or change once the FASD Respect Act passes, but getting that critical mass to get state legislation passed can take some time and some effort, and so it's worth doing. So currently we've got our lead authors confirmed. We've also confirmed an original sponsor. There are some other original sponsors that will be on the bill quite likely, but we did get word from Senator Moran's office in Kansas that he will be an original sponsor on the bill. Last time when we introduced, we didn't have any original sponsors. So original sponsors are co-sponsors that sign on in advance of the bill being introduced. This time we've created enough political will and enough political connections that we have people signing on in advance of the bill being introduced. So I'd say that's progress. We're going to show this every month just so we can kind of see where we're at on this pathway. Getting a bill passed is not, I quite naively thought it was a very straightforward process. You introduce it, they vote on it, it passes, mission accomplished. It's a bit more twisty-turny than that. And so as we walk through these steps, we're going to go ahead and just keep you updated with where we've been and where we're going. We are currently in the 118th Congress, and that congressional session lasts for 2 years. So you have, within those 2 years, time to get a bill passed. Some take the full 2 years, some pass right away. Depends on the bill, depends on what else is going on in Congress at that point. But where we're at is just on the cusp of being introduced and getting a bill number. So we thought we'd kind of recreate this slide each month and just add in where we're at, where we're going, next steps, so you can follow along with the process. So what's the holdup? We had originally thought and had been told by our legislative staffers that they were going to try to introduce really early on in the legislative session. And there's a lot of things that happened early on that made that not happen. But some of the holdup we've had right now, a lot of our congressional staffers have been sick. There's a lot of illness going around. They have had some issues in the Senate Help Committee with getting procedures organized. They have new leadership in Senate Help, and that's the committee of jurisdiction in the Senate that we need to get through. And so they've been having some challenges getting business done because between the two parties and the new leadership, it's been a little bit of a struggle, and they're working out the bugs. So that's been a little bit of a holdup there. I see the chat is going fast and furious, and I'm not able to address everything on this, but definitely with co-sponsors, and we'll get to this, if we had co-sponsors last legislative session, that doesn't mean they're automatically going to be co-sponsors this legislative session. So we will still need to do outreach. So in the meantime, while we've all been waiting with bated breath and like, okay, come on, when is this bill happening? Here's some of the things that have been going on. Susan and I both traveled to Washington, D.C. Again to meet with our authors and offices and see what we could do to kind of help push things along. While we were there, we did a slew of meetings, and Susan crashed a party at the Capitol, and met some additional congressional leaders. And I don't know, Susan, if you want to talk a little bit about that trip and some of the activity we had there up on the Hill.
Sure. Yeah. You know, the Hill is addicting. So I hope that, you know, who's ever on today and others will come out in September, because it really is a very interesting place. And when you have that human connection, I think it makes a big difference. So I was going to be going to dinner with Representative McCollum and some other congresswomen that she invited, and I had time, so I just was walking around in the Rayburn office building. I came upon the NAMI, their annual reception. And so I went in and listened to what they had to say and met their policy person and CEO, and Representative Tonko was there. And so I thanked him for his support and said what we were doing, and we were going to come back to him. And I don't know that he understood at all what I was saying, but he gave me a big hug. And so you never know, who you're going to run into. And I don't know, we may have said this last, we were walking around and we ran into, Bernie Sanders was going onto the elevator, and I said, oh, let's go. Well, we weren't going that direction, and we would have had to butt in line. So we didn't do that. But all in all, I thought it was a wonderful week, because a lot of times the staff don't even get a chance to have the time to connect all the pieces. And so we were providing that link, and we had terrific meetings with all of who you see here. And then I did have a great lunch with our dinner with Representative McCollum and Representative Pingree, Gwen Moore from Milwaukee. And Representative McCollum said she would prefer, and this goes back to how the bill becomes a law, would prefer that it be a standalone bill. And I would agree. I think, wouldn't it be great if we could have that and celebrate in the White House with the president signing a bill? But there's many ways that this can happen. It could, that could happen, or it could be, placed on another bill. So we'll just have to wait and see. Stay tuned on that. And I don't know if you want to pick up anything that I've.
Well, I think it was fascinating meeting with some of the legislators' staff. We did meet with Senator Lee with his office, and as you know, he was our blocker for last legislative session. And Susan and I were very professional. I maintained a poker face. But we met with his office and really talked about, the reason why he had blocked last legislative session. And the staffer himself didn't have a lot of information on FASD. And we were able to really give him a thorough education on, that this is a lifelong disability. He was under the impression that it was like neonatal abstinence syndrome, where, the effects went away with time. We were able to give that education. And so much of these meetings really are giving the education on FASD and, the prevalence rate. We had some staffers that were really just stunned by the fact that, this impacts as many as 1 in 20 school-aged children. Based on prevalence studies, and that this is lifelong, that this is something that can impact the heart, the lungs, central nervous system, as well as behavioral health and mental health. So even if we think our legislators know about this, it's still a great idea to have these meetings and give them those little tidbits of information so that they're not assuming things about FASD. We also, in addition to the meetings with legislators this last month, reached out to other organizations for informational meetings. We can't push the FASD Respect Act with the CDC or the American Association of Family Practitioners, but we can let them know that legislation is pending and they may be interested in looking at it. So we met with some of the policy offices and the policy officers for those agencies, as well as some of them we just let know that, hey, there's legislation pending on this, and they may consider being an endorser or signing on to a letter of support for the bill as well. So I thought that was important to include there, that it's not just reaching out to the legislators, we're also reaching out to organizations that could be potentially be of support in getting this passed. So this is something we started last legislative session, and I really want to kind of continue now so we can just see our progress as we go. Just maps of where we've met and where we have sponsors. So Minnesota, Kansas, and Alaska, we have one senator. A reminder, in each state, you have 2 senators and 1 representative. The representative covers your district or the area in which you live. And if you think that's straightforward, like I live in this town, so my representative is this, it's not that straightforward. Enter your zip code in at congress.gov, and it will tell you based on your zip code who your legislator, who your congressional representative in the House is. So your representative, otherwise known as congressperson or congressman, congresswoman, is based on zip code. And then your state has 2 senators that serve the entire state. In the House, here are where we had sponsors and meetings. So you can see all these little lines here. Those are all the various districts that have a congressperson. So there's lots of outreach opportunity there. Special thank you to Chris for getting this done, but this is our map of where we had co-sponsors, which districts we had co-sponsors in last legislative session. So if you go to FASDunited.org and click on the Policy Center, under the FASD Respect Act, you will have the option for individual advocacy and click on your state. In there, if you click on your state, you'll have a list of your legislative members, and it will also be noted there if your legislative member sponsored, was a co-sponsor for the FASD Respect Act last legislative session. So you can know if they might be a little bit more friendly to it or not. And then this is my fault, not Chris's. We actually had a sponsor, or we had support. So Alaska should be in blue here because Senator Murkowski was a sponsor last legislative session. We had 10 sponsors in the House and 74, or sorry, 10 sponsors in the Senate and 74 in the House last legislative session, which is pretty stinking good. But this is our Senate sponsors last legislative session. And again, apologies, Chris fixed it so Alaska was blue and I then forgot to include it. So that's on me and I apologize. So what do we do now? Where do we go from here? Now is the time to start up those legislative meetings again. If you have the ability to plan to travel to DC in September, we would really love you there for Hill Day. We plan on having as big a presence as possible on the Hill in September. Hopefully the bill passes before then, but just given how things are moving in this Congress, there's probably going to be a good opportunity, even if the bill does pass by then, to be up on the Hill and really be face-to-face with your lawmakers. They love it when you reach out to them, and the Zoom meetings are fantastic and extremely effective. However, being there in person sends a message that you care enough to be there. You care enough to travel there, and it's a really key, important issue. And I know not everybody can do that, and that is totally okay. But if you can, it's very helpful. There are instructions on the website for how to book your legislative meetings. If you are struggling with making connection to a legislator and are unable to book a meeting, Chris in our office does have a list of legislative staff where you could send an email and possibly get a better, and Chris, can you give a wave just so everybody can say hi and know you? There we are. Sometimes it's easier if you email a person directly as opposed to setting something up with their scheduler to get a meeting scheduled. So Chris can support with that. In addition, one slight change from last legislative session is that if you need to book a practice call with Susan and I, or you want Susan or I to be there to support you in your meeting, connect with Chris. He has full access to our schedules and can book things in for us. it's I just want to make sure that we're getting back to people as quickly as possible, and so we're adding a level of support for that. Obviously, you can still contact Susan and I directly, but I just am asking that Chris runs the calendar so that way our ducks are in a row, or our squirrels are in a conga line, and we all know where we're going. So one of the things we kind of toyed with here is, in the past, we used to do a list of, here are our priority states. Here are our priority members because they sit on committee. And I realized that that approach might be discouraging some of you to reach out to your legislator, because if you're seeing that so-and-so's legislator in Louisiana is on a select committee that we really need to get the bill put through, and yours isn't, you might think, oh, it's not that important. But critical mass plays a huge role in getting this bill passed. And so every single legislator really, really counts. So, definitely, if your legislator is chair of the Energy and Commerce Health Subcommittee, yeah, you want to reach out to them. That's a really important person. But equally important is, somebody who sits on the Agriculture Committee, because that's another vote. That's another person that we have showing support for the bill. So we did meet with Representative Trone's office while we were in DC, and he's chair of the Addictions Caucus, which is allegedly the largest caucus in Congress. And they have offered for us to do a congressional briefing to that caucus. Additionally, Representative Bacon chairs the Foster Caucus, and Senator Klobuchar chairs the Adoption Caucus. So we are working on getting briefings to those caucuses, some of which may be happening in September when we're all there for Hill Day. If it makes sense for the bill, we'll obviously do that beforehand. But we're working on that. I know the Problem Solvers Caucus is another one that's been approached and has been very open. Mental Health Caucus, that's another one that if your members are on the Mental Health Caucus, they're good ones to reach out to. And then obviously our committees of jurisdiction and those that hold the purse strings are always great people to meet with. And, just as an aside, many of us support or sit on boards or volunteer with or work with organizations that cover an entire state. It is okay, as someone who's involved with an organization that covers the entire state, to reach out to a member of the House, even if they're not your member, and talk to them about how your work impacts people in their district. That is it's still highly effective. So you're able to do that if you want to do that. It was asked that I share the names again of the Foster, Adoption, and Addiction caucuses. Representative Trone runs Addiction. Representative Bacon runs Foster. And Senator, Klobuchar runs the Adoption Caucus. There are other members, there are other chairs, there are other people involved, obviously, with those caucuses. But those are good ones to look into, and good ways to connect with your members of Congress if they are on one of those caucuses. You can kind of tailor what you're talking to them about based on the caucuses that they sit on. So I'm just looking at the chats. If there's any questions in the chat, I want to put that out there. But Barbara mentioned, and I really like this, that they've taken adults with FASD to the Hill, and it's very impactful. And I would wholeheartedly agree. this is an incredible opportunity for self-advocacy. We have had kiddos as young as 9, 10 years old on calls with legislators. If you think they're going to be squirrely, okay, you know, that's part of their disability. But kids, teenagers, adults with FASD, they are all more than capable of talking about FASD to their legislators, and it's highly impactful, both for them and for the legislator. So I encourage you to do that if that's something that your loved ones or you as a person with FASD are open to and excited about. So I'm excited seeing all the chat, and I'm having a hard time keeping up on all of it, but I'll do my best. And we're definitely going to save some time for questions at the end too. So if you have some questions that aren't being answered that are in the chat, you'll have an opportunity. Organizational support. Last legislative session, we had a huge number of organizations sign on to support and endorse the FASD Respect Act. The national organizations, you know, if you're involved with one, by all means, reach out to them. It's okay to double up. We're going to reach out to the national organizations as well. But if you own a business, if you're a member of a church, synagogue, mosque, if you are part of a Toastmasters club, a Rotary, a community organization, even your employer or you know, that kind of organization, those are all organizations that can support or endorse the FASD Respect Act. And what that shows to your legislators in your state, if you have those endorsements, is that there's broad-based community support for this legislation. So I encourage you to, if you go to the FASD United site, click on the Policy Center, or you can go directly to nofastpolicycenter.org. And then click on For Organizations. That's where you'll find the sign-on letter. Now, again, this is not a sign-on letter for you to sign as an individual. How you can help as an individual is reaching out to your legislators, your 2 senators, and your 1 rep. This is for companies, organizations, trade associations, things like that. So I want to kind of pause in the action on the FASD Respect Act and just acknowledge some things that are happening in states. I know last month we celebrated that Hawaii had a bill pass recognizing FASD Awareness Month. Our introvert friend from North Dakota had some legislation passed that got FASD more recognized broadly in the state of North Dakota. And Washington State had a bill passed that provided funding for support services for people with FASD in the state of Washington. Some bills that we're still following. Unfortunately, Florida's bill did die in committee. But again, sometimes it takes a while for bills to get passed. Nevada's bill is still in committee, so we're watching that. And that's a really big one because it's looking at Medicaid program coverage, waiver coverage for people with FASD. And where one state goes, other states might follow. New York is looking at adding FASD to the definition of developmental disability, also working on getting, you know, that's part of the pathway for waiver services. They're in a really hard fight on that right now. So if you live in the state of New York, highly recommend you reaching out in support of Senate Bill 1866. They're up against a tight deadline and to get that passed.
Yeah, I just want to add to that, Jen, that having North Dakota recently passed, that's gonna give New York advocates some ammunition it's in the Ways and Means Committee, which is the one that, you know, it's lives or dies. They look at the resources. And so having that path forward, I think is going to be really helpful. We'll see.
All right. And this month, I want to acknowledge and congratulate the Hawaii FASD Action Group on another major win. They have some funding for a 5-year pilot program to increase diagnosis or diagnostic capacity in their state. And if you haven't had a chance to interact with the folks from the Hawaii FASD Action Group yet, do. They are an amazing group of advocates and professionals, and just really have a good process and way of looking at tackling issues in their state systemically. So really highly recommend connecting with them if at all possible. And they've just got a great outlook on things. I really, really like how they're doing stuff. So congratulations to them. So that is kind of in a nutshell where we're at right now. We have some other things going. State report cards are going to be out soon. At least the templates for a couple of the states that have been started. And the state report cards are not an indictment of how well advocates are doing in their state. State report cards are intended to show how well the state as government is addressing FASD. And one of the things we've kind of run into there, and why this is taking a little bit longer than initially thought, is because there is a huge difference between, in many cases, between how the state law, the code, is written and how the agencies within the state interpret that code. So for example, there was one state in particular where we were looking at, and it showed that in the state law, it said that if a woman, or if there was alcohol use during pregnancy, that was grounds for termination of parental rights, which is punitive policy. That's grounds for removal. But in looking at it more deeply, the state agencies that do that interpreted that code differently, and in practice did not terminate parental rights or ask for termination of parental rights specifically because of that. They had other procedures in place. So it's a matter of kind of wading through what the law is versus what the policy is and how it's utilized in the state. So as with anything FASD, it is not quick, it is not easy. It is not as straightforward as we would hope, but definitely something that we're working on and is in progress. Additionally, in the next couple of days, we should have finally our FASD and education survey coming out, and this is a follow-up survey on to one that was done a few years ago, looking at how the interaction is and how people with FASD are faring in our education system. What is IDEA doing for them? And so that is in progress. We're just tightening up some of the questions, making sure that those are being asked in the right way to get the information that's needed to be able to build a report that gives the state of education in FASD from a policy perspective. This is not a research study. This is something that we're doing more from the policy side to see what data we can gather to back up any legislation that we decide to put forward, either this Congress or next Congress, on FASD and education federally. So that is also very near completion. I'm going to take a breath now. Susan, did I miss anything?
No, I think you covered it. And I just, yeah, I want to, having worked in this, this field for a long time, the difference between state law and how it's implemented are usually not exact. And a lot of times it gets down to resources. I mean, the legislature may have a certain idea, and there's only so many resources that can go to implement that, and so it'll be different in practice because they have to, they only have so many resources. So, but I think it's good to have a report card so we know which policies are unfriendly and which ones aren't. So I'm looking forward to that. And I know there's lots of sources out there that have different data points, but to have one specifically related to FASD, I think is going to be really important as we move forward with policy. So let's see, do we have questions? Let's see, I was just...
or any questions you care to ask out loud at this point?
Yeah. No.
Because I know if I say you get 15 minutes of your life back, then we're going to end up going an hour and a half over. So I noticed that Liz has her hand up, and then Kathy White has her hand up after that. Liz, did you care to comment or have a question?
Yes, good afternoon. Hopefully you can hear me okay. I just want to circle back to the caucuses discussion. And you mentioned the leads on the caucus, and then you said it's important to figure out where your members are working on these caucuses. And the question I have is, how do you figure out where your members are working on caucuses?
So one way to do that is just to go to your members' website, and they will typically list the caucuses that they're involved in. Another option is to go to the caucus's website, and the members typically will be listed there. Most caucuses do have a website. I noticed Carl, the introvert from North Dakota, mentioned that it's usually in the About link under the legislator's website. But yeah, usually they'll list what caucuses they are involved in on their websites there. And when in doubt, if you're really struggling to find out that information, give Chris a call in our office, and Chris will help find that information too. We don't claim to have all the answers, but we're good at looking things up. All right, Kathy, does that answer your question, Liz? Perfect. Kathy White, and then I noticed Kathy Hotelling has her hand up.
Thank you. The writing, the text as it's written now, do you anticipate it changing much in the next week or so that we hope to get it introduced in the House, or it will pretty much, it's already been hashed over and it's pretty close to what it's going to look like?
I think there's going to be some change. Oh, sorry, go ahead, Susan, you go ahead.
Oh, I just want to say, and I haven't, what's on the website was what they had given us, plus we had given some changes, and it's not going to change much from that. I think that's what Jen was going to say. They did and did take, unfortunately, the definition out, so that will not be part of it as far as we know. I know that the Legislative Council, well, that was their recommendation. But everything else pretty much will be the same. There's just some, like Jen said, just a few little tweaks here and there, and consistency of definitions in the bill. And well, I think one of the really important things in this work, there is a definition of FASD informed services. And so we're making that consistent, and that I think will be really important going forward, because the field will be able to look at that definition. And we worked with that definition with right, get me in your state, Jen, my Heather
Carmichael Olson.
Heather Carmichael Olson. Yeah, and she's done research, and so she helped us tweak that. It was longer that she gave us, but those ideas came from Heather Carmichael Olson. So that I think is will be new, and it will be, because I don't believe we had, maybe didn't even have that in the Respect Act. That'll be really important. So I think it's going to be, you know, and I know we've said this before, I think next week. I mean, we just heard from the sponsors this week, and they're still doing a little of that tweaking, but I don't think it's going to change much. So.
And it's interesting, like, you know, when you think of something as big as creating a bill, you would think that we would have this Zoom meeting where we all sit down together and we have an agenda and we go through these things bullet point by bullet point. It doesn't work that way. We get late night texts or emails from the legislative assistants saying, hey, look at this section, point blah, blah, blah here. Any tweaks you want to make, we're going to do this. You guys are like, it's all very kind of on the cuff. This is how they operate. This is how they work. There's a reason why legislative staffers burn out and aren't there typically for years and years and years, because it's an extremely demanding job and they are running on the fly. So it's not, you know, I would have thought that if you're introducing a bill and you're doing all these things with the bills, you're having those very thought out, structured meetings. Not at this point with where we are with the bill. And yeah, that just isn't the typical path. So it's a little fascinating to me to kind of see the inner workings of how the sausage gets made, so to speak, legislatively, because it's not at all what you would necessarily think. So Kathy Hotelling, you've had your hand up.
Yeah, good afternoon. As I said in the chat, we have a definition of developmental disabilities in North Carolina. We do not have a list of those. And you know, the pushback has been, well, it's just included. And I know very well that that doesn't help a lot of families who are trying to get on the waiver wait list and have to keep going back and back and back. And I'm wondering what our approach should be in trying to get a list started. I mean, for us to say, oh, we want to be on a list, I mean, you know, it seems like a lot of disabilities should be on a list, and maybe we should get the support of those other groups, or I'm not sure how to go about this. I take my lead from you two. And Carl, who's the introvert from North Dakota.
So Kathy, is it the federal definition? What is, and maybe Heather.
You know, I didn't compare it, but when I said to somebody at Disability Rights, we have started meeting with legislators because we want FASD as a named disability. She said that's not necessary, and she sent me what the North Carolina definition was.
So what some states have done is some states have made their definition broad enough that they feel it can include people with FASD, meaning that it does not have an IQ cutoff, meaning that it is looking more at adaptive function than IQ for qualifying. For some states, that's really worked. For a few states, FASD is a named condition. And it really depends on how the state as a whole works with disability services. And so that's where I think it's a very smart call, Kathy, to get involved with other disability organizations and other disability rights organizations to see what approach is going to work best given the confines and how your state operates, right? Because there's no one size fits all prescriptive, here's what you need to do in your state, because each state handles how they use waiver services and how they handle disability services differently. So right. one thing we're in the process of putting out, and I have to credit Heather French with some really great work that she did on this in researching, is the definition for all 50 states and the criteria for all 50 states and where you find that information on the state's website for all 50 states. So really being able to do a compare and contrast of what's going on in each individual state. And
where is that?
Heather literally just finished the first draft of it.
Okay.
Yeah, so that is on its way, but Heather's been doing a lot of hard work in the background of the navigation, because that's a question we get asked often in our Family Navigator program. And so putting together a foundational document on that was something that was prioritized. So,
the obvious.
I was looking at North Carolina, and you do have the federal definition, but they also added traumatic brain injury.
Right.
Yeah. Otherwise,
so the obvious group, especially in North Carolina, where we have just an overwhelming number of people with autism, or autistic people, sorry, because of the programs at UNC Chapel Hill, they don't really, you know, I'm not sure how interested they would be, because they have so much recognition already. But it, you know, we are not, our families get turned down routinely, even though they're, you know, they have adaptive functioning that shows they're at a very, you know, is very low. So I'm not quite sure who else to, I guess I could see how TBI got added.
I think that would be a good path to go down. And just, you know, realistically, I don't know that there is any disability group that is happy and or satisfied with disability waivers in their state. I can't imagine there's one, because they are not always easy to navigate. They're not always easy to get. They're not, you know, there's more screening out than there is screening in. I don't want to speak for all disability organizations, but in general, you know, if you're in any of the disabilities groups or anything like that, there really aren't a lot of people out there singing the praises of those programs.
Oh, right. We have 17,000 people on the wait list, and we have 14,000 that actually have a waiver. But it is much easier to get a waiver if you have autism as your diagnosis. That doesn't mean anybody's happy with the waiver services, you know, necessarily. I certainly am not. She has a waiver, so.
Yeah, so it's interesting. I'm looking at the definition of traumatic brain injury, and it says one or more areas of the following functions: cognition, language, memory, attention, reasoning, abstract thinking, judgment, problem solving, sensory, perceptual, and motor abilities, psychosocial behavior, physical function, information processing, and speech. You know, so FASD kind of fits right into all of those. They only have to have one or more, but it's, you know, it's something that involves an open or closed head injury. And
is that a national, who wrote that definition?
That's North Carolina. I'm just looking at North Carolina's.
Oh, okay. I'm sorry. Okay. I'm never on my phone, and I'm on my phone today because I'm at the pool. So I can't be looking this stuff up on the computer. Okay, thank you.
Yeah, you're welcome.
A good connection on that too might be, I know in Colorado, for education purposes, FASD is classified under traumatic brain injury.
Right.
Yeah, so that's an option there. So I noticed Liz McHugh, you have your hand up, and then I noticed Barbara Weibrecht has her hand up.
Yes, hi, I have Kathy actually prompted another question that I had written down before the call started, which is, from a visionary perspective on this, just step back a second, and you think about if the FASD Respect Act passes, will then there be a lot of requirements by the states to have FASD identified in the code so that it actually can flow down into the working machinations of the state? Or is it going to be a function of the federal law that allows that to move forward?
I think it's the case of money talking. I think that in today's political climate, being prescriptive of states is probably not something that would pass. So telling states they have to do something. Where the Respect Act, where it moves and where it lives, and Susan, please correct me if I'm interpreting this wrong at all, is that it gives incentive to the states to develop and work on and have FASD addressed in a statewide level. And it starts them out with looking at, do you have a plan for how you're handling FASD in your state? And then gives additional funding for programs and services to support that particular plan. That was the original intent of the bill, was to get states looking at these different silos systemically, and they're not going to do that without funding, because if they were, they would have already done it.
So let's just take Virginia, where I am, okay? Mm-hmm. There's no code mentioned that I can find of FASD anywhere in the Commonwealth of Virginia code. So I think what I'm hearing you say is that isn't necessarily going to mean it's going to take longer for Virginia to move forward with this. There may be other reasons why, but because it's not mentioned in the code anywhere doesn't mean that it's going to take longer for the federal dollars to flow. Is that what you're saying?
Right. That's what I'm saying.
Okay.
Yeah.
Well, and it's not a block grant. It's there'll be competitive grants. So, but the idea is that states will put together, and that's where the advocates can be very helpful, will put together their grant proposals. And there's some of the language we did add that states need to look at their existing funding sources that could be utilized in creating a task force or whatever. We had to take out all of that directive language, and so it's more permissive for the Secretary of HHS to come up with, you know, those grant application conditions. But, you know, states will be using that money to start looking at their programs, and just because they haven't there's nothing in the code doesn't prohibit them from doing that. I don't know if that's.
Well, and if anything, if you do have some federal funding on a cause, that's more impetus for the state to leverage those federal dollars and start doing their own programs, and you know, either moving funding to an FASD program or creating funding for an FASD program within the state to look at it. So I think it's a bit of a win-win. I think you know, Carl mentioned something in the chat about how you know, when he talks to state legislators, they say the feds need to do something, and when he talks to the feds, they say the states need to do something. I think the point is they both need to do something, and whatever impetus we can give to either or to start that process, you know, let's do that. We need to be working on both concurrently. So
yeah, I mean,
does that answer your?
Yeah, and there's so many, as I've reviewed all the various funding streams that go to the states, there's so many areas that if with just a little bit of effort and strategic planning, you can make sure that FASD is in the mix in how they administer those programs. And that's the intent, is not to just create this whole new FASD, you know. And a good example of that is ACE and trauma. You know, that has been infiltrated into a lot of the foster care, and the same could be said for FASD. And so, in fact, I just saw there's something that in juvenile justice, it was in the bill that Biden signed last December. There's funding that goes to for mental health and youth in placement facilities, and it's giving them be able to use Medicaid funding for doing various things. And one was, you know, mental health and trauma, and I thought, well, that would be a great place to have your state when they're doing that to include FASD. informed services and screening for FASD for those kids. So it's thoughtfully looking at all those programs. There's just a ton of funding that states are getting from the federal for issues related to FASD.
So Barbara, I think we'll call you last question. I know you've got your hand up. It is 1 minute over the hour. I apologize for running over, but I really appreciate the questions and the conversation. So I'm glad we were able to continue that. So Barbara, your question?
Thank you. I'll try to be quick. Our state, well, Debbie Stabenow signed up as an original sponsor. Now, because it's a new bill, does she have to do that again? Okay.
Yes, ma'am.
So she's not considered an original sponsor. No. The other thing I wanted to share was that we are having a statewide conference in September on FASD, and we haven't been able to have one for many years. And our limit is 300 people. But if we don't have 300 from Michigan and other people want to come, we will put you on a waiting list and allow that to happen. 300 is the number because that's the capacity of the place that we have. And there will be a lot of cutting edge speaking. For example, some things about what are common medical conditions related to FASD. How has dementia, how is that different with people with an FASD? Does it come on earlier? Is it more severe? Those are things we haven't talked about. And one of the things that we felt we really needed in Michigan was parents thinking ahead, many years ahead as to what happens to their child when they're not there anymore. And there seems to be some fear and resistance to that. So I'll stop now. Thank you.
Oh, thank you, Barbara. Appreciate the work you're doing there in Michigan and continue to do. Fantastic. Well, thank you all for joining us. Really happy you were here. Next month, I'm going to issue a small challenge. If you're able to invite just one person who doesn't typically attend, we are going to do a primer and a mock call with a legislator next month, so that you can see, and some of you who've done them a lot, you've maybe seen them done one way. We're going to go ahead and show some other ways to do it. And so I invite you, if you've got somebody on the fence, if you've got a parent caregiver, if you have a person with FASD that just wants to know what it's going to look like, we're going to go ahead and have that for you next month. Even if, like I said, you've done a ton of those meetings, it might be helpful to see it done through another lens. I'm not saying this is the perfect lens, the right lens, but giving you some options there. So thank you for the work you're doing around the country, and we'll see you all next month.
Thank you.
Bye, everybody.
Thank you. Bye.